Welcome back to the Whiteboard Series. I'm Dr. J. Michael Bennett. I'm a board-certified orthopedic surgeon specializing in sports medicine and minimally invasive surgery of the shoulder, elbow, and knee. Today we're talking about popping joints, specifically we're talking about the elbow, painful popping in the elbow or a painful pop in the elbow. So what do? If you particularly found yourself in a position where you were lifting something heavy and you felt a loud pop in your elbow, or it almost felt like somebody slapped your arm, and then you notice significant bruising and swelling in the elbow. Well, what could that be? What could that mean? Well, first off, let's go over some of the basic elbow anatomy. This is an elbow joint here. This is the humerus that you're seeing right here. This is the radial head, and then the ulna. So there's three bones that articulate that create the elbow joint that allows you to flex and extend, as well as what we call pronation and supination, which is palm down and palm up. The ligaments that stabilize the elbow are the ulnar collateral ligament on the medial side or the inside of the elbow, the lateral collateral ligament, which is the outside of the elbow, and as far as other tendons and important tendons around the elbow joint, there's the biceps, the distal biceps, which asserts on the radial tuberosity right here, that allows you to give you strength with supination or twisting, as well as with flexion. And that's where the biceps comes down and inserts right there. So, going back to the scenario we just discussed, what happens if you lifted something or caught something and felt a painful popping in your elbow, you notice a lot of bruising and swelling afterwards, what do? Well, the first thing you want to think about as a possibility is your biceps tendon. And that biceps tendon comes down and inserts right on that radial tuberosity. And when it does pop, it will disrupt right at the base where it inserts, and it retracts. Okay? And depending on how much degeneration you have at the distal biceps, or how strong of a force it was that you caught something that was falling, depends on how far it's going to retract upward. There have been some patients that have maybe a partial tear of the distal biceps. Sometimes you can have a full thickness rupture where it retracts all the way up past the joint line, where it's significantly retracted. Because all muscles retract like a rubber band when you take it and it snaps back. So the muscles are going to do the same thing. The thing about the biceps is that if you do have a distal rupture, it's serious, and you want to get it looked at immediately, especially if you're active or you depend on a laborious activity. Typically you want it to be evaluated by a specialist, because if it is a significant tear and you depend on your hands for a living, it might be something you want to consider to have fixed. So the way we fix this is we actually bring this biceps tendon back down to the bone and repair it down to the bone. If you do not fix it and it continues to retract upward, you can lose significant amount of strength with rotating and with flexion. So just keep that in mind and get it evaluated. Other possibilities regarding the popping and clicking in the elbow joint, particularly followed by swelling. If you did have a history of a trauma or a fall in the elbow, you can have a dislocation of the elbow. When a dislocation occurs, you can get a disruption of all the ligaments here in the elbow, the medial and the lateral side of the elbow, because that actually means that the joint has physically popped out. It's popped out a joint. So the ligaments on the inside have been torn, the ligaments on the lateral side have been torn, or at least stretched. A lot of these dislocations do actually fairly well without any kind of surgery. So we actually just splint you and actually put you in a range of motion brace for about 4 weeks or so and get you moving, and a lot of these ligaments will actually stabilize. So you can actually get by without having to do anything surgical if you do have a history of dislocation. It's very important that if you do have a dislocation, it be immediately popped back into place and reduced. So you do go to the emergency room or seek the help of an orthopedic surgeon to at least get you in a good alignment and get the joint reduced. So that's a dislocation. Usually we see those usually see those in the emergency room, or we see them on the football field, or anywhere the patient's had a traumatic injury to the elbow. Now, other elbow injuries are overuse injuries, and these can occur in baseball players and throwers. It usually occurs with repetitive movement of the elbow and stretching of the ligaments. Particularly the most problematic or most common one is the ulnar collateral ligament, and this is usually seen in throwers. And this is where this ligament is actually disrupted, and the elbow becomes weak. And when the elbow becomes weak, and this medial side becomes weak, these bones open up and separate because the stabilizer is gone. So if your livelihood is throwing for a living, this is something you have to have diagnosed and treated appropriately. And a lot of times that can require a Tommy John reconstruction if you depend on throwing as your livelihood. If you're a professional athlete, a collegiate athlete, a high school player that has a potential career in throwing in college, this might be something that you need to have reconstructed, so please see an orthopedic specialist to get an appropriate recommendation and evaluation. Now, you can't have stretching of that ligament or even a sprain of that ligament, and that oftentimes can be treated without surgery, just using a brace and conservative measures. Now, the other elbow, which is the lateral collateral ligament, goes on the outside of the elbow. When that ligament is disrupted, which can also occur with a traumatic injury, such as an elbow dislocation that just didn't heal right, and this bone, the radial head here, can pop out of joint because these ligaments here are no longer there. And so when you supinate or rotate, you actually see this bone pop out of joint and you have to pop it back in. That's called posterolateral rotatory instability, and that does need to be evaluated by an orthopedic specialist to make the diagnosis. And oftentimes, depending on your age and activity level, that can require reconstruction or surgery. The last thing that may be causing some popping or clicking in the elbow, particularly associated with pain, may be a cartilage flap or a loose body. That's where a piece of cartilage from anywhere in this joint becomes dislodged from the cartilage, from the insertion site here, and it just starts floating around in the joint. Or it can actually hinge on the cartilage here, and it creates a locking sensation in the elbow. Sometimes we see this in kids. It's called osteochondritis dissecans in kids and adults as well. But usually if an adult has this, sometimes this is associated with significant arthritis in that joint. Either way, if you have a loose body floating around the joint, it can cause significant damage to the surrounding cartilage and speed up arthritis. So this is something that you need to be evaluated, needs to be evaluated and diagnosed early to make sure you do not have progressive arthritis at an early age. So if you have any of these symptoms that I'm describing, please feel free to seek out advice from an orthopedic specialist, or feel free to contact our office at 281-633-8600. Or for more information, access our website at www.orthopedicsportsdoctor.com or www.jmichaelbennett.com. Thank you very much.